Okay, so when it comes to diabetes, what bothers me or what saddens me is that most people think that they've been super healthy and then they go to sleep one day and wake up with type 2 diabetes the next day because they are not warned enough. They're not given enough warning. Their insulin levels, for example, aren't checked. So it takes 15 to 20 years to be hyperinsulinemic and then become type 2 diabetic. So how do you explain this to your patients with regards to heart health? Because I'm sure no one ever goes to sleep completely super healthy and wakes up attack the next day. How do you prevent that from happening? Because we need to go, I think we need to prevent it, right? I mean, we need to go back.
Absolutely.
Yeah.
Absolutely. Yeah. And that's part of this thought that if LDL is your only focus and all you're looking at is a high LDL, and then one day you have to treat the LDL. Oh, I'm treated. I'm fine. You know, I don't have a heart risk anymore because I'm treating my LDL. Like that concept has to get thrown out the window. And exactly like type 2 diabetes, you know, your fasting blood sugar could be 98, which is normal, but it could be 98 with an insulin level of 2, or it could be 98 with an insulin level of 42, right? And those are completely different scenarios. And so I guess the analogy for cardiovascular health is you're not just looking at the LDL, you're looking at the HDL, triglycerides, blood pressure, and you're looking at lifestyle in general and what they're doing. So it's really trying to factor in all these health factors. And what are you using to measure risk? Are you just using a surrogate like LDL, or are you getting a coronary calcium score, which actually tells you if you have plaque in your arteries, which is such a more powerful test than just LDL. Now, it's not perfect either, but so much better to measure sort of more of an end result than just a surrogate marker.
So talking of all these sort of different tests or preventative tests or exams at least, why is it that we don't routinely check, or at least annually or once every 2-3 years, a detailed lipid panel, for example, a more detailed one? I've never had one done because it's not offered by the British National Health System. We just do the basic ones and that's it.
Yeah. Well, because if your biggest concern is LDL, that's all you need. And if your treatment of choice is a statin, that's all you need, right? If you want to know what type of effect lifestyle interventions have on lipids, then sure, measuring your small particles is really important. Measuring your VLDL is very important. Looking at your ApoB is so important. So, but if all you care about is what's your reaction to statin and do you need a statin or not, then I guess LDL is all you need to measure. So that's why. I mean, it's unfortunate. And the same for calcium scores, right? Like, why aren't people getting calcium scores routinely? Well, there's fear of radiation, but a calcium score is such low radiation, like 1 millisievert or less, depending on where you get it done. Doesn't mean you want to get one every month, of course, but to get one as baseline and then get one a year or 2 or 3 or whatever later to see if there's progression. I mean, it makes sense if you're worried about your cardiovascular health. And you want to make sure whatever radiation you're getting that is going to help impact your understanding of your health risk and the potential treatment, whether medication or lifestyle. So if that's the case, I'm a big fan of more people getting calcium scores.
So who do you recommend the CAC test for? What sort of...
Is everybody too broad? Is that too broad of an answer? Everybody? I mean, look, probably 40-year-old and up, right? If you're under 40, the validation of calcium scores is not well done, and chances of it being anything but 0 are so low that maybe it's not worth it, except strong family history, or you've already had type 2 diabetes, or you've been a big smoker, or you have familial hypercholesterolemia, something to significantly elevate your risk then at a younger age. But 40 and above, probably a good idea, certainly 50 and above. And certainly anybody who says, look, I want to make a change in my lifestyle now and see what effect it has over time. How do I measure that effect? Calcium score is a great way to do it.
I was just trying to figure out if I need to go for one too, approaching 50. I've never had one done, but then there's type 2 diabetes in my family, not necessarily heart attacks, but type 2 diabetes runs rampant.
Well, and with type 1 diabetes, your risk is certainly higher for cardiovascular disease, right? Like I'm sure you're under outstanding control now, but like you said, 20 years ago when you were told to eat whatever you want and cover it with insulin, and people's goal A1C is 7, that's like perfectly good and acceptable. An A1C of 7, that's nowadays that should be total mismanagement when you can get it down to 5.5 or lower perfectly safely with nutrition and medications. So people with type 1 are at higher risk. And so I think they should get calcium scores.
Mm-hmm.